Hi there. So thanks for the introduction. So what does Super Mario Brothers, dating apps, and medical data have in common? Well, probably not much, but I think they have the potential to save lives. So actually, my interest in these three things started when I was 19. Nintendo had just came out with their remake of a classic game, Super Mario Brothers. And boy, I spent quite a lot of hours playing that game. And also during that time, new type of social media websites called dating websites, one of them called Match.com, came online and became quite useful for someone like me who was afraid to talk to girls. And now I'm only allowed to talk to my wife. But also, sadly, when I was 19, my grandma, who had been living with us and raised me in Canada, had passed away from a heart attack. But she had also battled late-stage colorectal cancer for many years. And 2 years before that, my grandpa, who had been living with dementia and Parkinson's disease for almost 10 years, had passed away from complications with pneumonia. Till this day, I wonder what truly killed them. Was it the cancer, the heart, infection of the lungs, their dementia? Later, I found out that actually 1 in 10 cancer patients die because of problems with their blood vessels or their heart. And actually 90% of dementia patients suffer from another condition. When I look back at how me and my family cared for my grandma, I remember some of the toughest times was actually when we were trying to prioritize which physician to go to whenever she had an issue. Should we go to an oncologist to look at her cancer? Or should we go to a cardiologist to look at her heart? Or a respiratory physician to look at whether her lungs were okay? This was a tough question, but eventually we can get an appointment with one of these physicians. But another problem arose. We had almost 10 plus years of medical history with these complex diseases to go over with that physician. If she was alive today, I think that situation would be even tougher, because she was quite technologically savvy. She would have had a smartwatch that tracked her daily activities, and she would probably have had some genetic tests which had information about the 3 billion letters of her genome. For even the smartest specialist doctor, I think all this information would be difficult to go through, especially for patients with many different diseases. And now with doctors' times being stretched and squeezed even more, and people developing multiple disorders as they age, I think this problem will only get worse. But fortunately, the same kind of technological advances that have brought us the ability to generate all this data has also produced faster computers that allow us to handle vast amounts of data. Now computers equipped with a type of artificial intelligence or AI method known as machine learning has recently demonstrated superhuman abilities to self-learn from data and make informed decisions. Actually, recently, these machine learning algorithms have shown that they can actually learn my favorite game of Super Mario Brothers in just a matter of minutes. So sadly, my Super Mario career is over. But luckily, for my scientific career, I can use the same type of machine learning methods that are used to learn Super Mario Brothers to learn about patients who have complex diseases. We can learn from their physical attributes, their genome, learn about their heart, their bowel, their lungs, and much, much more. we can use these algorithms to find new ways to connect patients together, but there's a complication with my Super Mario Brothers analogy. In our case, there is no big bad boss on that final level. In fact, in our case, we might have to beat multiple diseases in order to save that patient. So how might we try to do this? One way is to use machine learning to connect patients based on commonalities in order to link different diseases together. We can connect these different diseases using another approach by forming networks of patients. You can think of this as approaches that my dating apps and social media websites use to find friends that have common interests, friends or companions that have common interests. So it's still early days, but one common feature that we found that links different types of heart disease with lung cancer and dementia are the white blood cells that mediate your immune system. Another common feature that links multiple diseases are mutations in the DNA that appear in different parts of your body but give rise to different diseases. So if we can identify these common features, we can potentially design or develop more powerful ways to target multiple diseases and help patients like my grandma. It is my hope that in the future, we can avoid treating diseases individually and reduce chances of over-medicating patients, but instead treat the patient as a whole. So next time you look at your smartwatch or your medical report, please remember that your data may not only help yourself, but may also help your loved ones and grandma and grandpas all over this beautiful world. Thank you.